What if you're shooting blanks and have absolutely no idea? What if your semen looks completely normal but medically contains zero sperm? Welcome to Reproductive Health Explained, where we make reproductive health simple and easier to understand. Most people assume male fertility is automatic. If a man can ejaculate, he assumes everything is working. Biologically, that's not true, because semen and sperm are not the same thing. Semen is the transport fluid, while sperm are the microscopic reproductive cells made inside the testicles. A man can ejaculate normally and still have low sperm, damaged sperm, or no sperm at all. Inside the testes are tiny sperm factories called seminiferous tubules. This is where sperms are produced through spermatogenesis. The process depends on healthy testosterone signaling, healthy pituitary hormones, cool testicular temperature. If any of these are disrupted, sperm production drops. So your body may release semen, but contain very few or zero functioning sperm. This diagnosis usually comes as a complete biological shock to many men. And this is where two realities appear. Low or damaged sperm, what most people call shooting blanks. Zero sperm, a medical condition called Azoospermia. Azoospermia means complete absence of sperm in the semen. There are two main types of azoospermia. Non-obstructive azoospermia, where the testicles fail to produce sperms properly. Then we have obstructive azoospermia. The sperm may be produced, but a blockage prevents them from entering semen. One might ask, why do we have more and more cases of rising infertility in men? And this is where modern lifestyle comes in place. Tight clothing, laptops on the lap, long sitting hours, hot baths, and obesity raise the scrotal temperature. Testicles hang outside the body for a reason. That means the sperms need cooler temperature. So too much heat literally slows down sperm manufacturing. Hormone damage is another cause of male infertility. Poor sleep, chronic stress, processed food, alcohol, endocrine disrupting chemicals, and excess body fat can reduce testosterone and confuse the pituitary signaling. Without proper hormonal communication, the testes stop receiving strong instructions to make sperm. Toxins, smoking, vaping, pollution, pesticides, plastics, and heavy metal increase oxidative stress. That means sperm DNA gets damaged, movement weakens, and sperms die earlier. Testosterone misuse and steroids. This one shocks many men. When men inject testosterone or anabolic steroids, the brain thinks enough hormone exists already and stops signaling the testicle. The testes then shrink their own sperm production. Some men become temporarily infertile from this alone. So yes, a man can feel masculine, look healthy, have normal sex drive, ejaculate normally, and still have biologically compromised fertility. That is why male infertility often stays hidden for years. The frightening part is this: you usually don't feel the low sperm count. You'll discover it only when pregnancy doesn't happen. Your body can fire, but biologically it may be firing blanks. So remember, prevention is better than cure. If you care about reproductive health, subscribe to Reproductive Health Explained, because your hormones may be saying more than you realize.